I'm so pleased to be able to extend my sincere appreciation and warmest greetings to all the nurses across Vancouver Coastal Health Authority as we begin to celebrate National Nurses Week. As nurses, you make up the largest part of the healthcare workforce, and as a result, you have an incredibly important role in helping to provide safe, appropriate, effective, and quality care to patients and families, not only across VCH, but across all of British Columbia. The theme of this year's National Nursing Week is Nurses, a Voice to Lead, Health for All. It was developed by the International Council of Nurses, and it reflects that every nurse has a story, and all of those stories combined can make a powerful impact on the health and well-being of the patients and families we serve. Health for All not only refers to the kind of health services that we all need, but also helping people achieve an optimal physical and mental state of well-being so they can lead socially and economically productive lives and achieve optimal health. I've been privileged to be able to travel across our province and meet with over 2,000 nurses who provided some direct feedback that was validated with them and created the Nursing Policy Secretariat's Priority Recommendation Report. If you haven't had an opportunity to read that report, it is available online. Those recommendations, there are 50 of them, are grouped into 13 different themes. And there's work happening right now to implement those recommendations. About 60% of them are in progress, and about 18% are now complete. So a number of structures have been created to advance the work across BC. Provincial Nursing Network has been created with stakeholders from a number of groups, as well as a practice education working group. And then there is a couple of groups that are providing advice, as well as information around nurse practitioners in BC. Those structures together are advancing the implementation of all the recommendations in the report. Over the last few months, they had a provincial planning session that involved a number of stakeholders from the regulators, the association, nurses in practice, students, the union, and nurses from around the province to help look at what we should advance next in terms of the recommendations not yet started. The changes in scope are always done in a way that is of value to patients and families that we serve, and values, of course, to nurses themselves. The work that's currently happening has already been changed within the regulation, and that's to enable prescribing within a certain scope for registered nurses and registered psychiatric nurses. So the college is currently working on enabling prescribing for those members of the nursing family. At the same time, we're working with our stakeholders and partners to examine a number of things like the ordering of basic diagnostic tests, or looking at discharge according to certain criteria, and other elements of nursing scope that would benefit them and the patients and families we serve. The practice education group that it's co-chaired by Hannah MacDonald, who is the chair of the Nurse Educator Practice Council of BC, and Joanne McLaren, who's the executive director of the Nursing Policy Secretariat, is actually looking at what does entry to practice need to look like for nurses across the province in the years to come. They're currently focused on registered nurses at the moment and considering how they change both our 4-year BSN program and what that might need to look like in the future to better meet the realities of practice across the province, as well as how do we do a better job of helping people transition from being a student and into practice over those first 6 months to a year. Practicing nurses are absolutely part of all of the structures, and of course more than 2,000 of them provided feedback into the recommendations that are now being actioned. So they will continue to have a strong voice as we move forward, and there are a number of organizations involved in those structures, from the regulator, the association, the union, nurses in practice, students and faculty and others, all of who are nurses, giving feedback into the process as we go forward. So their voice and their advice and feedback remains a critical part of the work we do as we continue to advance these recommendations. British Columbia is home to some of the best and brightest healthcare professionals in this country, and nurses, of course, are no exception. Whether you're a nurse at the point of care, an educator, a researcher, an academic, one of our many nursing leaders, members of one of the associations, a nurse practitioner, advanced practice nurse, registered psychiatric nurse, licensed practical nurse. You all do such an incredible job every day at making significant impact in a positive way to the patients and families we serve. So I just want to really congratulate you and thank you for the quality of care you provide day in and day out, and wish you all the best in this Nurses Week for 2019.